Hey Tyler, I'm Andrew, an RT here at the hospital. Hear that you're doing okay. We're going to send you home now. I'm just going to show you how to use a peak flow meter and give you an asthma action care plan based on what you get when you're using this. Because we're going to send it home with you, so I'm going to show you how to do it, show you what each measurement means. There's like basically 3 classifications. If you're good, you're green. If you're in the yellow band, I'll explain what that means relative to the spacing on here in a moment. Then you're going to want to keep taking the medications that you're prescribed, that be either emergency meds and controller meds. And then of course, if you're below the yellow band or zone, you want to then use your meds and then make an appointment as soon as possible to get back in and see how we can reassess the situation. So, like I was just saying, what you do when you use this is you blow into it. So you're going to make a nice tight seal around the opening. I'm not going to use it because I wouldn't want you to have to try to use it after I did. So you take a big deep breath in, you're like, and you blow it out quick, within a second. You're getting rid of it. And then what this will do is it'll take that force that you exhale and it will show you these 3 different zones. The top zone, like I was saying, green is fine. You're doing great. That's where we want you. Yellow zone somewhere in the middle, between those 2 pointers I've got set there. And then that will be the zone in which if you're blowing and getting into here, then you're going to want to be making sure that you try your meds. Okay. If you use the meds like your albuterol or your control med on the regular normal cycle, and this isn't improving, we're going to classify that as red as well. And that means keep taking them and make an appointment. And then of course, if you're blowing,
Do I have to go to the doctor right away, or can I wait a couple days?
you can. I believe you just make the appointment, take your meds. If you're really feeling as though there's an emergency, if you're that uncomfortable, of course come in. You get on the phone, you say, hey, I'm coming. More than anything, we want you safe and to protect you. So we don't want you panicking at home alone. And then of course, the red zone at the bottom is the same kind of outcome. You want to be quickly on the phone with the nurse or doctor's office, and then you guys make that decision together.
And take your meds.
And take your meds right away, your emergency meds. All right, so like I was showing you, take a big deep breath for a balloon.
Yeah.
Something like that, but you do it at the end of this. All right? Yeah. Try to get a nice tight seal with your lips. Big breath in. No harmonica. Tight seal. So when you have that opening near your mouth, you put your mouth around it.
Okay.
And that way it's accurately measuring. You're not losing any of the force that's coming out of you. Because this thing it's going to tell you, how well do I exhale? My man, you seem to be doing just fine. All right. Well, it sounds like your meds are working just fine and your lungs are doing good. Yeah. And so if you would want to have that kind of a technique. If you're falling into this range here, we can assess if this gets bumped or whatever. We can do a little nomogram. I can show you the equations for how we're estimating your zones for you. And that should be all that we need to manage. Do you feel comfortable? Do you want to show me or explain it back to me at all?
Yeah, so if I blow in the green, it's good. Just do what I've been doing.
Yeah, like a light. That's why unless of course you're colorblind, they would have confused you. But
in the yellow, I take my meds.
In yellow, you take your meds.
I have to go to the doctor too?
You don't. You do not have to go to the doctor. The
Okay.
yellow's basically just a cautionary zone. It's saying, am I gonna
I remember.
take my meds? I'm gonna go back into green.
Didn't feel good.
Take my meds.
After
If I
took my
don't,
meds to go.
call myself a little more emergent to at least be, calling the doc and making sure that you set things up to go see him.
And the red, you said take my meds and go to the doctor.
Absolutely.
All right. How often do you do this?
You should be trying. In terms of the flow meter, I believe you're at least doing this once a day.
Okay.
Yeah, I think it's a daily exercise to get an assessment of where you're at. And of course, if you're having an attack, any kind of if something's coming on, you take your meds, you assess at that moment. But I think this is a daily exercise to kind of just see where I'm at, how am I feeling.
Excellent.
Okay, any other questions?
Can I go home?
Yes, you may.
Cool.
All right. Cut. that. Was that the right answer?